Well, tonight we're learning Montanans who don't carry health insurance or may have lost it when they got laid off because of the virus, they may be the most vulnerable. So we sent Q2's Andrea Lutz to find out what resources are available if you find yourself in this position.
It seems there may be some heavy barriers for those still working in jobs where they cannot telework. Jobs like the service industry, servers and drivers, cooks, even construction workers. It's these workers that may face the biggest challenge if they do end up getting the coronavirus because they report they have no health insurance. And it's these kinds of jobs that have an increase in the risk of exposure to COVID-19, according to research from the Kaiser Foundation. The study says in 2018, nearly 28 million non-elderly people in the U.S. lacked health insurance.
I think that is the key to this right now. It's like you can't wait until you have an accident with your automobile and then go and get insurance. It doesn't cover it then. People need to go out right now and be covered.
Montana Commissioner of Insurance and Securities Matt Rosendale says there are options if you don't have health insurance right now.
Don't wait until you get sick. Don't go uncovered. That is really a big thing.
The state of Montana offers short duration health plans where you can sign up at any point in the year. Rosendale also says if you recently got laid off, you could be eligible for COBRA benefits through your previous employer, but premiums could be much higher. Health insurance through the federal exchange is still an option because losing your job is a qualified circumstance through the Affordable Care Act. And there is some good news for those who still do have health insurance.
Anyone whose physician has recommended that they get tested for COVID-19, that test is free of charge, and all the major health insurers here in the state have waived all the co-pays and deductibles in association with that testing.
The Families First Coronavirus Response Act was signed into law in March, which may ensure more uninsured can access free testing. However, the legislation doesn't necessarily address coverage of treatment if you do get COVID-19 and don't have health insurance.
Whether you're going to have a conversation with your landlord or whether you're going to have a conversation with your insurance agent, as soon as you see that you're going to have difficulties in making those payments to any party, contact them immediately, because we are finding that everyone is making provisions and trying to work together so that we all can get through this very, very difficult circumstance.
In Billings, Andrea Lutz, MTN News.
Thanks, Andrea. Now, Andrea says it's unclear if Congress could back additional programs to cover those without health care.